chiropractor, Dr. Gregory Johnson, and today we're going to be showing you how we treat a patient that has numbness and tingling, specifically on the side of her hand down here, little finger and the side of her hand, which is the C8 dermatome, as well as the C6 dermatome, the thumb area. And she's on the computer several hours a day, and this has gotten worse since she's been on the computer the last couple of weeks. So we're going to be treating that today by evaluating her first in posture, and then treating her, decompressing her, and adjusting her. So let's take a look at your posture. And let's have you close your eyes and flex your head forward and backwards. You can tell a lot by a patient's range of motion, and her range of motion is actually pretty good, but she had a little bit of pain going backwards, and her right shoulder is a little higher than her left shoulder. Okay, we can take a look. You see how your head's turned a little bit left today too. Very good. Okay, let's come over here and lay on your back. So we're going to pin her pelvic bones in and decompress her spine, which takes pressure off of those compressed discs. When discs get pressure on them in the front, they bulge out backwards, and that creates bulged disc. You've probably heard of that. That can also lead to herniated disc. But when it pinches on the nerves, it can cause numbness, tingling, pain, weakness, and a number of other types of dysfunctional problems with the musculoskeletal system. So you want to get their legs up parallel with the floor. I get a wet towel and wrap right around her occiput. And she makes sure she keeps her teeth together and just takes a deep breath through her nose. And I catch her at the right time. There we go, better. That was perfect. You feel that all the way down? From your neck all the way down to here?
Yeah.
Good. Yep. Check your reflex here. Yep, she's got a little bit there. She's not kicking too high today. You felt that a lot in your neck though, didn't you? Okay. Adjust her neck right here while she's here. We're going to adjust her lower cervical spine, because this is where, this is where the C6 and C7 and C8 nerves come out of the lower spine. Okay, so let's come over here on your tummy and put your face right down in there. So we always check the patient from all the way from their feet all the way up. So her right leg is short by about 1/4 inch today. It gets longer when I bring it up, so that tells me her pelvis is out, and you can see that her pelvis lifts up and twists when I do that. Is that tender right there? So she has a sacroiliac subluxation on the right, which we are going to be adjusting in the X, Y, and Z axes. Sacrum right there in the middle, straight down with the Y-axis and Z-axis. Left sacroiliac joint, and back to the right one. Now we're going to get right on L5, L4, L3, L2, and there's L1. Now she's got some ribs that have been also out of place off and on for a while. So we always make sure and do a lateral and oblique stretch to get those ribs and vertebra stretching, and then we adjust her thoracic spine from the lower thoracic all the way up. This area of the spine, the thoracic spine, affects the sympathetic nervous system, which is what people get fight or flight from, which is a very primordial neurological response to a number of different situations. It's like when you scare a cat, its tail gets real big and hair stands up on its back. It's either going to fight or flight, flee. Very good. Now, because she's got all this cervical thoracic stuff going on, we're going to get in here and work on these trigger points in her trapezius muscles, levator scapula muscles, and her rhomboids. Those are tender, aren't they? Is it more tender on the left? Yeah. And you can usually tell which side has the most stress on it And that's the one that's been going numb the most too, huh? Yep. So that's usually a correlation right there where you find these trigger points where there's a problem. That one's sore too. This is the levator scapula. It goes right from the corner of the scapula to the cervical spine. Yeah, I'm sorry, these are tender. I'm going to get in there and use the vibrator on now to, let's make sure she's lined up first. Yes, she's exactly even now. So again, you're going to see we always stimulate the tissues very deep, especially on the sides of the thighs here, which is the tensor fasciolatum muscle. Most people call it their IT bands. And the hamstrings, all the way down into the gastrocnemius or the calf. Same thing on both sides. There we go. And she's got trigger points down in her sacroiliac regions as well, which most people that do sitting throughout their day in their work usually get, because the body really wasn't meant to sit for that many hours per day. We're going to get in here and get kind of deep. Now, this paresthesia problem, which is numbness and tingling, that's the scientific name or diagnosis for it. It's called paresthesia. It can be caused from pinched nerves out of the cervical spine or the shoulder, elbow, and or wrist. And if you have it in the wrist, that's called carpal tunnel syndrome. If you have it in the neck and the wrist, it's called double crush syndrome. So we want to make sure we address all of those areas. Okay, let's have you turn around on your back, and I'm going to adjust your clavicles. Slide down this way all the way. There we go. A little bit more. There you go. And do that. Perfect. We're going to be adjusting her AC joints right here, her clavicle right there, and her ribs where they attach to the sternum. Same thing over here. I've already got the AC joint and the clavicular sternal joint and the costosternal joints. Now let's have you sit up sideways and we'll get your shoulders. You always put these through a normal range of motion just to find out if there's any crepitus or grinding in there, and there really wasn't a lot on the right side, and she wasn't out as much over there. Now this one's a little bit more grinding, but you just put those back in place and adjust again the elbows and the wrist. Here we go. We squeeze the radius and ulna together as well as the carpals, and then also do traction at the same time to open up the carpal tunnel. And then we're going to do the same thing on the side where she has the paresthesia. Now that one moved better. Excellent. So see, her left elbow and wrist as well as her left shoulder was out more so than the right side. So we're going to do the same thing. We're going to get traction by pulling the hand out and squeezing on the radius and ulna and the carpals. There we go. Okay. Now, hold your thumb and little finger together like that for me. I'm going to pull it apart. Hold. See, her strength's really good there now. On both sides. Did that feel strong on both sides to you? Good. Okay. Now, we're going to end up the adjustment or finish the adjustment with a instrument on her atlas to make sure that we get her cerebellum, which is the hindbrain. It's the very back part of your brain that controls balance, posture, coordination, and all kinesthetic movement. So let's go ahead and do that again. Flex forward and backwards. Yep, and neutral. That looked a lot better actually. Take a look. Better. Still a little bit rotated. And we'll come straight back. We put her in exactly a mirror image of her current configuration. And then we just put a little tap with this instrument specifically on the atlas. Okay, you can relax. And let's try that same thing one more time, please. Straight as an arrow, straight as an arrow. Did that kink up at all? Very good. Okay. And that's it. We'll see you next time.